growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, I'm Dr. Steve Rasner. And if you're listening right now, you are tuned in to the Lionhearted Dentist Podcast, a podcast I started approximately 2 years ago. And it is a blueprint for you to get to a very special place in general practice dentistry, or even if you're a specialist. It's based on the cornerstones and foundations of what I was fortunate to create over my career. And I'm giving it to you because I enjoy doing it. I enjoy the feedback I get, the emails from colleagues all over the world I'd never dreamed would be tuning in I'm serious, from Vietnam to South Korea to Australia, all the countries of Europe. It's very inspiring to me, Brazil. So keep your emails coming, and be glad to take your suggestions on what direction you'd like these podcasts to go. I always like to give you my email, so you can do that, and that's pretty easy. It's my name, Dr. Rasner, DrRasner at AOL.com, no period. So let's get right to the meat of the subject. In the last couple podcasts, I told you I was going to kind of steer away from the weekly reporting on what I'm doing in my office regarding the corona pandemic. I feel we're at a point, you think I used the expression in my last podcast, it's time to get back in the gym. Meaning, look, I don't know what the future is going to be. There's a lot of recurrence here in the United States of numbers that are very troubling with regards to the virus. I don't know how that translates, nor does anyone else. All you can do is do your best to protect what you spent a lifetime thus far, whether you're 25 or my age, building. And that's what I'm doing. And I'm going to tell you straight up, I've been back about 6-7 weeks now, and we're about 20% below where we were a year ago. And I can live with that if that's what it is. To be honest with you, it's kind of pleasurable. It's kind of nice to not have to work quite as hard. Look, maybe I'll be giving you a different story in a couple of months. I don't know. But one real fact for me that makes me feel affirmed when I speak to you weekly is that a lot of the principles that I have delivered to you over this last couple years have actually come around to save me during this pandemic. The concepts that you hear me talk about you, branding, trust, and confidence as the number one thing you want to communicate in your community. In other words, you want people in your community that hear about your practice, that the first thoughts in their mind is they can trust you, you're not going to upsell them, that your work is trustworthy. And that also speaks for the confidence part when I say trust and confidence. That is so huge. And I think you're so off track, at least it's my opinion, if you're starting a new marketing campaign on All on 4, or, as a GP, or anything like that. If you think that the way to this dream practice that you're trying to develop is by being the economic dentist in town, by lowering your fees so everybody will come to you, or for that matter, I know this sounds maybe controversial to some of you, or the convenient dentist, that you'll be open late at night and that's your shtick. That's why you'll get people to come to you. And I'm telling you, that's not it at all. If you really think for a second about who you go to for whatever services you desire, from your place of banking to where you get your car fixed, to the physician that you use. Look, I had to choose a new physician last January for the first time in about 5 years. True story. He was recommended to me by a plastic surgeon. So I didn't just look in the yellow pages. And I went to this office at 6 o'clock at night, and it immediately looked, as soon as I walked in, it looked dingy to me. It looked dirty. But because it came from a highly respected source, I gave it the benefit of the doubt. And unfortunately, I had almost an hour to assess this new office before I was seen. So that's problem number 2. And as I was assessing it, I looked around the room and I saw really heavy religious messages as well. That was the station on the air and the radio for that office. My point is that this is a physician that's not new. He'd been practicing, by the looks of him, for 25, 30 years. That's a pretty easy one for me. Okay, if we can't beat that scenario as a dentist, then I think we have some serious problems. So these avenues that I'm giving you, these cornerstones, they're not rocket science. They are what have worked for me, and they're working for you even though you don't think about it in your daily lives about who you choose to do business with. And so we've talked about a lot of issues over these last several months about how to survive all this. And you heard me say that it's time to get back in the gym. Meaning it's time for you to give it everything you have and take this moment, this opportunity in your career to solidify the direction of your practice. And I can't give you a better set of tools to do that with, without a doubt, than case presentation skills. And we're going to spend quite a bit of time on that because it takes quite a bit of time. There's nothing else that we talk about in terms of what will have the most profound impact on your practice. Think about it. Patients come to you and I who don't know you other than what you've branded in the community on a weekly basis. I don't know how many you get per week. I don't get nearly as many as I used to. And I don't know what quality of patients that you're getting, and that's a big comment for me to make. And we could spend several podcasts just on marketing if we wanted to. And perhaps we will do that again. Well, I mean, over the year and 2 years I've been on, we've had a lot of time to visit many, many subjects that make up a successful practice. So some of them, for sure, I'm revisiting from different angles. In fact, the case presentation has been talked about in earlier podcasts. But we need to get back to that because it's by far, when I look at the weeks I have that have been successful, or the years I've had that have been successful, it comes down to, if you think about it, that moment of truth where I get either a new patient into my office or a patient out of hygiene that has needs. How do you approach that patient? What is your protocol? What comes out of your mouth is everything. And I got to tell you, humbly, I'm trying to make this humble, that I have an extraordinary percentage of case acceptance when using the principles that I use that I want to deliver to you. And that's why we have to spend this amount of time. And please write to me if this isn't your cup of tea or if you want more information. Most of it I've talked about in the past, and now I'm coming at it from a new angle. And I will cover that as well as we go into it. So let's get into it. Let us first understand that, well, let's go back for a minute. Case presentation, how you spend your days, whether they're productive or another kind of a wasted day, whether you're doing 10 patients a day and you're doing single crowns on those patients, or you're doing just a bunch of operative dentistry and you feel unfulfilled at the end of that day, at the end of the week. Don't you understand? That's your case presentation skill set. That's where that comes from. Patients don't call your office and understand the merits of a comprehensive exam. They don't know what that is. They know they have a broken tooth. They know they have pain. They know they have something they don't like. And of course that's how patients think. It's your job to explain and in a patient-friendly manner the benefits of a comprehensive exam without scaring them out of their wits. And that's what I'm going to help you do. It's the challenge of your office to augment that for you, because you can't do that alone. And that begins with the first thing we need to talk about, and that would be the new patient phone call. Briefly, as I'm taking you in, I'm going to give you the outline. You must know it, because I don't want you to think it's just the words that come out of your mouth when you walk in that room with the patient that needs something. That's not case presentation. Case presentation actually begins with the branding, the money and time that you're putting in to branding within your community is where case presentation begins. I'm dead serious. So my branding over the years has been trust and confidence of patients. I have a few angles that I brand. Another one is that we're the practice that provides no-cost oral sedation. There's no doubt about that a lot of the people that arrive in front of me in a chair and want my recommendations already are there partly because they know that we sedate patients. Seriously. And there's another big body of patients, and that puts me in a tremendous advantageous point of reference when I'm talking to these people. A lot of them, based on the marketing I've used, also know that we're a practice that is individually oriented per patient. I mean, I actually market that type of message for them. You know, that it's not a one size fits all, you know, as you would. And then, of course, the most, as I've said, is that they can trust me, because they can trust me, as I'm sure they can trust you. And if you don't know or think that you're getting that message across, and we're going to be very specific in these next several podcasts as to how to do that. I mean, there's key words and key references that I would think most of you are not saying, that you actually should be saying to a patient to have them let their guard down. We all know that it's not what you say, it's how you say it to somebody. That's not unique to a dentist in a dental chair trying to explain to a patient the merits of having a certain amount of work done, which, by the way, costs that patient a certain amount of money. Are you kidding me? I mean, if you think of the epic challenge for a minute that you actually have, you have this patient coming into you who maybe has never met you. They've heard about you, but they've never actually met you. They're going to walk in your office, and under my guidelines and blueprint that I'm trying to share with you, they very well may make a commitment to you, and as in trust, of something that exceeds whatever the money is. Doesn't matter to me, but it's often north of $10,000 or more. That's a huge thing. That doesn't happen by random accident. And even if it wasn't that, even if your practice is terrific when it comes to cash flow and bills and paying your bills is just not an issue, the merits of having people trust you and being in that environment day in and day out go a long way towards preventing burnout, go a long way towards helping your professional self-esteem as a dentist is what you've accomplished. I mean it. I mean, if I had to work on people that I feel we talked into something or were lamenting the fact that they made a significant investment to have done what I was doing, that would not make me comfortable a little bit, nor would it make you. So I know I'm going off on a couple tangents before I get to the meat of it, but it's important to understand the broader picture why we're talking about this. This is how you spend your days. You know, you heard me talk about the dream practice earlier in this podcast. What is that? I can tell you what it is for a lot of us, certainly what it is for me. Number one, it's walking in on Monday and feeling whoever's in that reception room of yours is proud to be your patient. They want to be there. Then the dream continues by you walking past the staff that you've invested a lot of time in, that get you, and you see with your eyes the protocols being performed, almost like a symphony. That may sound melodramatic to you, but it's a good way to describe it. They're doing the things that you took time to make sure that you wanted done, that are part of this process that is called your practice. And then you walk back to an operatory where your clinical team has already been there and they are prepared for this day, and they're prepared, by the way, on time for this first patient that you're about to work on. It's seeing that day, seriously, maybe 4 to 5 patients that are probably sedated, most of them, and doing enjoyable, confident procedures that you've trained, because certainly abundant CE is a big part of my vision for you to get to where you have the type of practice that you hear me describe. That's why you're doing all this. It's leaving at 5 o'clock and having some kind of personal life that goes along with the big investment of a professional life. It's all of these things. That's why you're doing all the things that I'm hoping that you'll look into doing. Okay, so let's break it down. Let's go into what this process is that results in extraordinary high case acceptance, since it's the most important part of what you do each day, or leads to what the most important part of what you get to do each day. We're going to hammer it again. We're back in the gym, as they say. So I told you it starts with the first phone call. Certainly having some random haphazard process. Patient calls your office and there's really no protocol. It may be different people answer that phone call. That's not what I'm talking about. You've got one or more people, depending on their talents, who are very, very skilled in taking this new patient phone call through a process that enables them to know what to expect when they get to you. I have to say it like that because that's part of how I get to the end. And you need to know that over the years, I've had hygienists come to me and say they won't let me take a full set of x-rays, or they don't want their whole mouth examined, or whatever they're telling me. And I had to develop systems so that would not happen. And this is part of that. So if you go back over the things we've sent you over the years, for those of you that requested, this is basically under the guise of the new patient experience and a lot of the things I'm about to say, but that does influence, of course it does, what happens when I get to the operatory. It's not a trick, it's not a gimmick, it's just treating people, in my opinion, with respect and value, because they do have a chance to opt out, and some of them do, at the initial phone call. So you need to go back. I'm not going to break down the phone call so much because that would require a whole podcast. And I already have, I believe, that on very early podcasts, and that part is worth just revisiting. I do want to make the point that it can't be an ordinary person going through the motions. You know, I have 20 employees. I've got really one who's better than the rest that I like to take this opportunity that I don't get as much as I used to with a new patient phone call. And their job is to make this patient feel totally informed and comfortable on what to expect when they get to my office, meaning a full exam. They didn't call and ask for a full exam. That's how we do stuff. That's how you should be doing your dentistry as well. And I do have many podcasts on the comprehensive examination. I have multiple podcasts on that. And we might tie a little bit of that in over these next several. So what you need to do is ask yourself, do you have that right now? Is it just random? Is it change every time somebody calls? Because it doesn't change for me. And by the way, I'm going to break down case presentation and case acceptance into the new patient, which is what I'm talking about now, and a patient coming out of hygiene, because they can be different for many, many reasons. Okay? And when I get to that, I'll make that very clear. In other words, a patient that was in your hygiene schedule and they have a need to do something, well, that's case presentation also. But back to the new patient. So they are handled in a protocol that we have laid out, and it's handled more importantly by somebody that likes to do it, not somebody that you got to hope they're in a good mood. That is not the right person for this. And if that's who's doing it for you, then you've got the wrong person. You can't have that happen. I think we all usually are pretty lucky to get that one person or more, maybe some of you have many, in a career that just bubbles over the telephone and bubbles over the enthusiasm they have for wanting you to be successful. They feel ownership of the practice. And of course, if somebody feels that, it probably is a reflection of what you have done to make them feel that, which is part of your job as a leader, by the way. So the new patient phone call outlines what they can expect at this first visit. So there's no surprises by me. Nobody's coming in and being surprised that this could take every bit of 90 minutes or more, that we want a significant other there. It's not a deal breaker, but we push it hard, particularly if they've indicated significant need. And then when they get there, what's that protocol? If you're tuning in right now, say, oh, I've heard him say this before. Have you? Are you implementing it the way I'm telling you? Because this is exactly how it goes down. I'm telling you, it's exactly what I do. They get a very thorough new patient phone call. They come in, and the process continues as I'm describing. First of all, we are absolutely on time. They do not sit in my reception area. Well, in the Corona era, as I'm sure you're doing in your office, they're out in their car, they call, we're ready. But even before that, and after that passes, the way we're doing it right now, we're on time. There's just no reason not to be. And they come in, and either they have filled out the prior paperwork online, and if they haven't, they fill that out, and then they re-meet with the person that took this phone call to review the mini dental history that took place over the telephone. By the way, if you're new to my podcast and you are hearing things that you don't know, just jot it down, write it to me, and I'll direct you as where to get more information, or I'll give it to you in an email. What I'm discussing is the new patient experience protocol right now, and it's all relevant. What happens in that new second interview? The first interview was over the telephone. Now there's a second repetition of that information on purpose, because we've discovered over the years very clearly that often the information is much more detailed as to why they're telling us what they're telling us. In other words, I think sometimes patients are in denial over the telephone, as if they don't tell you the other things going on in their mouth, you won't find out. Seriously, I really think that's part of it. And look, there's a lot of dentists out there. They don't all do comprehensive exams. They don't even all take a comprehensive set of radiographs on a new patient. I mean, it's a big world, so I don't even know what to say about that. You're either in or you're not, to me. If you're in and you're a dentist, then do it right. But when she interviews the new patient, often with a significant other, in the office for the first time, which I'm going to be coached on, opens up a whole litany of new information that was not told to me or her being the new patient coordinator, over the telephone. So that is a absolute must. That's not an option. You must re-interview them. Again, if you want that type of information, be specific when you write to me. Okay. The third thing is what else is going on in the office at that time? I mean, maybe you have a small office and the front desk receptionist is the same person that does what I just described. That would be difficult, by the way. I would hope that would not be the case. And so the other people in my office are very aware of the having Ritz-Carlton / Four Seasons Hotel people skills. That doesn't mean that they wear fancy suits to my office and talk with the most proper etiquette. For those of you that envision that type of Ritz-Carlton, no, it's treating people with value everywhere they feel and look. It's walking into a spotlessly clean office, not just in the front radio, and I mean glass, wherever they see glass, wherever. It's just having people work for you that know that you insist and value a Walt Disney clean type of environment. And you can't fake clean. It is clean or not clean. The restroom, a lot of people that come in to see us, one of the first things they want to do is, do you have a restroom? I mean, you could eat off the floors in a kitchen, in some people's kitchens, and you could eat off the floors I know that's gross. In our restrooms, they are spotlessly always clean, as should yours need to be. So there's a lot of wheels turning here, right? It's not just walking in and handing somebody paperwork. There's visual components going on. And I could tell you very inexpensive ways to make your practice look like a spa, which is what I think you can never go wrong with. I think you could go wrong with trying to make it look too frilly or successful, waterfalls, and forgive me for those of you that have that. I want patients to let their guard down. I want them to be soothed. I want them to be comfortable. I think it all adds up to this extraordinary case acceptance percentage that I end up with. You know who I don't get case acceptance on? Patients that just have no access to finances. And because of HIPAA laws, I'm kind of handcuffed with how far you can take that over a telephone. And quite honestly, with proper etiquette protocol, I'm handcuffed even how much in an initial interview you can ask those type of questions, even though they're very relevant to that patient's treatment. So all this stuff is going on, the visual component, what they're seeing. Did they walk into a reception room before Corona that's got 18 people, there's no chairs available? That would never happen. That would never be my recommendation in your office. If you're that busy, congratulations, but you're headed towards a bad place, in my opinion. And if nothing else, the bad place is up here in your head. So I can tell by my time that this is going to take a lot. I want to recap what I've talked about today. I'm talking about getting back into gym. And when I say getting into gym, strengthening the skill for you that has the most influence on what you do every day. Has influence on every single thing you do. Your cash flow, your peace of mind, your self-professional esteem, all of it. If people say no to you or only accept what insurance covers, then you're in for a very different experience than which the Lionhearted dentist is trying to advocate. That's the truth. So, and there's a lot that goes into it, and you must get it in this series of podcasts if you think you had it before. I'm the kind that I need to hear things 2 and 3 times. It's just the way it is. For recap, I talked about the essential need to have the right person taking that information in, and then the process unfolding as they get into your office, and what do they see, feel, what's happening next. A second interview is one of the first things as soon as the paperwork's done. Being greeted by auxiliary staff who may be in the arena. Do they know what the protocol is for new patients? Or are they too busy to make eye contact? That happens. It never happens in a 5-star hotel or any 5-star business. Anyway, I hope this is a good direction, because my goal is to get you the practice that I've enjoyed or something similar, because you're going to love it. Hope you're hanging in there with everything. Hope you have a good week. See you next week on the Lionhearted Dentist.